Everybody's looking for signals and the ways she might indicate how she's going to go. And one of the ways is how she sees Obama and his overall effort on health care. I asked her, first of all, whether she thought Barack Obama, like other Republicans, is a big government liberal.
No, you know, it's interesting. I don't. In fact, I almost sense the opposite. He's been very realistic in his views on health care, understanding the implications. I get a sense that he does study these issues very carefully. He has deep conversations with his staff who advise him on health care. He's told me on several instances where he has actually, been reading the memos, studying the issues and what's changed in various positions or concepts that we had been discussing within our group of 6. So he seems to me to be very well informed, well briefed, well versed, seriously immersed in the issue, recognizing the implications, and he understands that there are fundamental differences and disparate views and how controversial they could be. In fact, I've gotten an impression that he would, probably do less than more.
Do you see him as a moderate?
More moderate than liberal on this question. He has advanced the issue of the public option, but I have sensed from the outset that he might be far more flexible on that question many months ago when I had an initial discussion with him on health care itself. But also in the ensuing conversations, he has seemed to understand others' views. He obviously puts it forward because that's been his position. But I think he's always indicated a willingness to be flexible on this, on other issues, and taking into account some, differing views on the subject. And he certainly was more than willing to listen to my views and others. And he also has, he solicits contrarian views and conflicting, positions so that he can better enhance his own approach to it. And I think that was illustrated in his speech of last week before the Congress and to the American people, is trying to outline some of the misconceptions and fallacies surrounding a number of issues, and secondly, understanding that there was a lot of confusion that had emerged as a result of the variety of initiatives that had already been considered in various committees in the House or Senate.
Senator Snowe indicated there are some changes she wants in the bill. She'd like to have more subsidies for low-income people to buy insurance, perhaps financed by reducing the level of insurance people would be required to buy. But she's satisfied with the overall level of cost controls, and she may offer that triggered public option, not likely in committee, but on the floor of the U.S. Senate. And I would say from this interview, Maria, the White House has reason to be optimistic that she may be on their side in the end.
All right, great, John.